Good evening and welcome to Christopher Kniff and Saqib Hussein's final project in QMB6166. I'll be your presenter tonight, Christopher, and let's get it going. The increase in demand for medical devices and equipment, especially syringes and needles in healthcare centers, increased the need for efficient management of supply chain that ensured proper flow. Johns Hopkins and Cleveland Clinic health centers are world-renowned and among the most preferred clinic centers known for their quality and customer service. To keep up with the increasing demand for syringes and needles, the hospitals have adopted advanced inventory management methods. They help prevent excessive stock, shortages, or demands in the organization and reduction of costs for client satisfaction. Methods adopted by Johns Hopkins hospitals include computerized inventory management and shared services. In contrast, inventory methods adopted by Cleveland Clinic include computerized systems, just-in-time inventory management, and automation and warehouse management systems. Advanced inventory and supply chain management methods ensure to inform the suppliers of the clinic's needs on time and smooth flow for the equipment from manufacturers and improved patient experience. While both Cleveland Clinic and Johns Hopkins Hospital use remote patient monitoring to ensure adequate patient supplies due to patient influx, it also extended their ability to reach during the coronavirus, reducing equipment shortages. The availability of RPMs allowed monitoring of patients through mobile medical devices and personal communication devices. This system helps save lives, especially the elderly, which can be monitored in real time, allow for better quality of life through virtual channels such as emails, phones, remote specimen collection methods, along other portable medical devices. Medical technology continues to evolve, making healthcare delivery efficient and stable. Realigning supply chain operations aims to improve health service outcomes and patient experience. In healthcare, supply chain management involves regulating how goods and services flow from manufacturer to patients. The healthcare chain works through a variety of processes involving teams, surgical equipment, and other needed products, and ensures proper linkage of the equipment to the various hospital operations, departments, and revenues. Syringes and needles are some of the most essential medical equipment alongside other diabetic supplies. The process of identifying, obtaining, and supplying the equipment should be timely to ensure efficient benefits and satisfaction of clients. When RPM systems are implemented, it is more likely to result in reduced hospital stays. Patients, when in recovering periods, they can go home and be monitored hourly or daily. Reducing hospital stays will result in less dependency and usage of hospital resources. Monitoring patients in isolation or at home through RPM systems will reduce the number of infections compared to when handled or monitored directly. Diabetic supplies are among the most valuable pieces of medical equipment in the world. Needles, syringes, and other diabetic supplies are a matter of life and death for people with diabetes. The equipment is often used with medication, with fluid withdrawal, and vaccinations. In 2020, the world was affected by the ongoing COVID-19 pandemic, and all aspects of the healthcare system changed internationally. The demand for equipment increased due to more numbers of people admitted to hospitals. Some institutions considered using diabetic needles, increasing demand from the manufacturers. Johns Hopkins and Cleveland Clinic health centers are among many organizations whose needles, syringes, and diabetic supply chain have been highly affected by the COVID-19 pandemic. A significant issue in the supply chain occurred when international governments allowed for diabetic insulin needles to be used for COVID-19. Claiming that the Pfizer vaccine would produce 2 additional doses, with China having 1.4 billion people and Japan having another 125 million, you can only imagine how detrimental this is to people that have diabetes. Where maintaining proper insulin levels could mean life or death, not to mention challenges for vaccinations or any other medical procedures that incorporate these essential medical supplies. As you can see here, an insulin needle is very much smaller. It's about a 36 gauge. It's about a ½ inch. This needle here is about 1.5 inches. It's a 21 gauge. The larger the number is, the smaller the needle. And obviously, having these syringes being taken up by 1 billion people, can you imagine what it would do to the diabetic community? I mean, this is a very serious issue, and it needs to be resolved. And that's why the supply chain is very important. Johns Hopkins Hospital is famous for its leadership in inpatient care. The hospital services are trusted as they place caregivers in departments that meet their specialties, and the use of RPMs to ensure a smooth flow in goods and services to patients. Achieving efficiency and a smooth flow in the supply chain has made Johns Hopkins management adopt a shared service supply chain method while implementing remote patient monitoring. The hospital service center aims to achieve excellence in service delivery through the practical application of technologies. The hospital operates hand in hand with Johns Hopkins University. The advantage of shared services in the supply chain include avoiding duplications of supplies, reducing waste, and making it easier to save costs. A supply network is a collection of suppliers that assist the organization in adding value to clients through manufacturing and efficient delivery. The network extended to the organizations of direct customers, which involves the patients with RPM. The supply chain network is described as downstream or upstream. Johns Hopkins is one hospital that takes significant steps to balance the accurate demand of supply of medical equipment and ensure reduced costs and increased savings in the supply chain. In addressing rising prices, the hospital uses the Noble approach. This approach involves joint ventures between Allegan Health Networks and Johns Hopkins Health System. Collaborating allows the hospital to consult with other clinics concerning the best sources for supplies. Buying syringes, needles, and other diabetic supplies from manufacturers in bulk reduces the purchase price. Also, the connections have enabled the easy advancement of inventory management tools and tactics. Johns Hopkins Hospital uses business software that helps in tracking the current amount of inventory. Tracking the equipment helps the operation team know when to replenish their stocked inventory and the amount of equipment needed. This system helps track the user waste and obsolete equipment with monitoring patient outcomes. The following graph shows the impact of improving supply chain methods of customer satisfaction. This is from Johns Hopkins Medical Center. So the HCAHPS here expects a 75 percentile, and that's the hospital consumer assessment of healthcare providers and systems. And what they do is that they grade every hospital in the country, and depending on what your score, it affects your client base, your patients, or what you might get paid back, and there could be you'd be penalized. So the average is a 75, which is like right about here they want. But Johns Hopkins, they have themselves, they want to be like around, you know, a 72%, and so basically the average of all hospitals, I guess, was about 78.7%. So this is where all other hospitals are. And about, I would say, I believe in January of 2019, where you look right here, that when they start their supply chain, they really started to keep themselves above the median, obviously, and the range they wanted, but they kept themselves at about an 82.6% percentile. You see that they're here above, and that, like here, back in 2017, they're erratic. There's up and down, and then as of January here of 2019, they were obviously able to keep on course. And this is very important to hospitals, because when people like ourselves, we go and look, for a hospital, and we want to look at ratings, it makes a difference. How nice they are, how well they treat patients. Nobody wants to have thumbs up or thumbs down and negative context put to it. Cleveland Clinic was operating through manual methods of stock control and supply chain management. However, the clinic's management realized to stay in line with their motto. Cleveland Clinic adopted a just-in-time manufacturing process. This method enabled the clinic to supply the required number of medical equipment at a moment of need. Efficient supply control techniques lead to cost reduction and improve patient satisfaction. The following presentation shows how improving inventory methods in 2006 led to increased patient satisfaction, reducing Cleveland Clinic complaints. So if you look here, this is Cleveland Clinic scores all the way through, and these are the different years. So as you go through, you'll see 2014 to 2017, and then as they increase their thing, you can see each year that this is the national average, and this is Cleveland Clinic. Cleveland Clinic always, it was more superior than all the others. At Johns Hopkins Hospital, the management oversees the shortage of medical equipment by applying the shared method approach. The hospital collaborates with other healthcare institutions that obtain equipment from the same suppliers. The practice reduces supply costs for manufacturers and replenishes equipment to their former levels. Hospitals have adopted advanced technologies in inventory management. The technology involved the automation and ease capture of equipment information through automated identification and data capture, AIDC. Relevant technologies allow the supply team to identify when a syringe, needle, or other equipment was removed from inventory. Updated information helps the clinic notify the supplier of required supplies. Also, the technology allows real-time stock counts. A real-time count helps in determining organizational needs, preventing deficiencies. Most manufacturers are overwhelmed due to the increased demand of needles and syringes for COVID-19 vaccinations. Real-time updates help coordinate with the suppliers for needed inventory. At Cleveland Clinic, the manufacturers improve supply chain management techniques by adding and adopting computerized systems, patient monitoring, and just-in-time stock management. Adoption of these reforms made the clinic one of the most preferred health institutions due to their high level of patient satisfaction. Adopting a computerized system helped the clinic update the traditional manual methods of data keeping. Automated inventories helped communications with suppliers concerning needed equipment. The software system allows visibility of the entire clinic inventory, enhancing a smooth distribution of equipment. The following is the application of various supply chain management theories that Hopkins and Cleveland Clinic used. Resource-based, network perspective, material logistic management theory. Here we made a little value stream map of Cleveland Clinic on this side and Johns Hopkins on this side. Cleveland Clinic and Johns Hopkins and these patients with RPM here and here. And what it was is that everything is relayed through the system and relayed back to the supply chain. The only difference is that Cleveland Clinic had warehouse suppliers, and Johns Hopkins used clinic, community, and other community clinics to reduce their pricing. These are services that were saved on the servers that were used with the system. In conclusion, for an organization to operate efficiently, they need to adopt an efficient strategy in supply chain management. Johns Hopkins and Cleveland Medical Centers are among the most preferred health centers in the world. The organization has adopted inventory methods to ensure increased productivity, quality, and speed, and improve patient experience. The method involved adopting inventory management technology, shared services, just-in-time, and remote patient monitoring and automation. The warehouse management system, the methods led to a smooth flow of syringes and needles and other medically necessary equipment from the supply to consumer, boosting customer experience and expanding the healthcare market base. These are our references. Thank you for listening to our presentation tonight on the supply chain at Johns Hopkins and Cleveland Clinic. And I appreciate and thank you for your time. Good night.